All right. It's a new day in America today. That's right. Provisions of the Health Care Act, the Affordable Health Care Act, have kicked in. There are certain things that are going to happen. Contraceptives, for example, are now covered and forced to be covered by insurance companies. That was very controversial, as you know. The Catholic Church, which provides health care for many people, didn't like the fact that, in lieu of their religious beliefs, that they had to do this. The other thing that's really changing and has been changing is some of those checks are going out. Now, there's a provision of the Affordable Health Care Act that if the person that is administering your health care through insurance, if they are taking too much for administration, and it's all based upon percentages, then by golly, they're going to refund you some of your premium money because they're getting too top heavy and they're not putting the money actually into health care. Now, some would say that's government intrusion into private business. I understand that viewpoint, albeit I'm sure that those who got the rebate checks and who already received the rebate checks are saying, well, wait a second here. This isn't so bad. This isn't so bad. And quite frankly, the insurance execs aren't doing so bad either. And so to sit there and say that all of these insurance companies are taking all of those premiums and putting them to work for health care, well, there's questions about that. And so what we decided to do was to call Blue Cross Blue Shield, the biggest health insurance provider in our region, and basically ask them. And we went right to the actuarial department. Jim Wynstra is with us. He is Blue Cross Blue Shield's Director of Actuarial. Jim, good to have you on News and Views.
Hello, good to be here.
Are you sending out rebate checks?
No, Blue Cross Blue Shield of North Dakota is not sending out rebate checks. We've met the requirements fully. The requirements are, you take the premium dollar, and once you take out premium tax and other fees, what percentage goes toward medical care? And so the requirements are for individual and small group business, 80% of that has to go to health care. For large groups, which is 51 and more, 85% of that has to go to health care. And so for Blue Cross Blue Shield, an individual, we had 98% going to healthcare in 2011, and for small group, 87%, and large group, 92%. So we were well above the targets of 80% and 85%.
Jim, do not take this the wrong way, but I mean, you're a bean counter. That's what you do. You figure out the risk. You look at the numbers. You make sure at the end of the day all of the financial planning works. Were you ever fearful that this would be a problem for you?
No, I really wasn't, because historically we've been well above those targets, and so I really was comfortable with these requirements.
And yet so many companies aren't meeting that requirement and having to send out rebate checks. So was there really an issue here?
I think there is an issue with certainly some insurance companies. Our target risk charge or profit charge, whatever you want to call it, is very, very slim, roughly 1%. Other insurance companies, they may be a stock company and are looking for more profit, and also their admin or commission charges to their brokers are fairly high, and so they do. There are some companies that struggle to make that requirement. In total, 13 million Americans received refunds, and that is less than 5%. So it's not like most insurance carriers were having an issue with this, but it is an issue with some.
What would it have been? Do you know what the numbers would be if this law had been in place last year or 5 years ago? In other words, did companies clean up their act when it comes to the overhead of all of this, knowing that this was coming their way?
I do think they probably did clean up their act a little bit, but I think in general, I do feel like a lot of the Blue Cross Blue Shield companies at least would have met this several years ago, and so it's not been an issue. Also, I would say that some states already have some medical loss ratio requirements, various medical loss ratio requirements, but the standards set by the Affordable Care Act were probably higher than what most states had, especially in the individual market.
So as you look about how to write these policies in a way where the numbers will work, so that Blue Cross doesn't go, in the hole on this, and they remain in the black. When you're sitting there looking at the Affordable Health Care Act and knowing that politically this football is still being tossed around, how much hair have you ripped out?
Well, I think there's a lot of other more complicated parts of the Affordable Care Act than this medical loss ratio. So there is a lot of work, and really the coming 2014 exchange, I think, is really the most complicated area of Affordable Health Care Act, and so that's really what we're starting to focus on now is the 2014 exchange, and there's going to be new products, there's going to be new requirements to the plan designs, etc. So there will be a lot of work in the next year and a half.
Does it help that the very Blue Cross Blue Shield locally here that I'm talking to right now actually helps set up exchanges in other states? That has to be an advantage to you in terms of, number one, knowing the law, number two, knowing what your risk is.
Yeah, it certainly helps, but there's the challenge. Part of the challenge is the federal government is still setting up regulations and guidance to the law that was passed, and so we don't have the complete story yet. And even though we're involved with setting up exchanges, there's still information yet to be had in order to finalize all that.
Who's empowered to bring that to you, and why don't you have it yet?
Well, I would say the law that was passed is fairly complicated, and so HHS is really the one driving those regulations, the Human Health and Services. And so all I can say is it's very complicated, and I understand their end that it's kind of that it takes a while to get it all together, but we're eager to get the information and move forward. And so it's a combination. Certainly, we would like the regulations to go quicker, but we also understand that they are complicated.
Yeah. Jim Wynstra, thank you so much for your time. The whole point of all of this is everybody knows that there's rebate checks coming, but they're not going to be coming from Blue Cross Blue Shield of North Dakota, right?
That's right.
All right. Jim, good to visit with you. Thanks for your time.
Thank you.